Good evening. My name is Jennifer Stretton from Hamilton, Ontario, and on behalf of my co-host, Marie-Louise Martin from Calgary, Alberta, we'd like to welcome you to another segment of the CANIBD webinar series. Many of you are aware that CANIBD was created to support nurses across Canada who work with patients living with IBD. Our network of nurses are committed to providing mentorship and learning opportunities to IBD nurses, create networking opportunities and share best practices, and promote nursing excellence and elevate the profile of IBD nursing in Canada. Before we begin though tonight, I'd like to take a couple minutes to thank our sponsors. Some of them may be joining us tonight. With their generous funding, CANIBD has been able to develop education programs, host an annual conference, and importantly, tools like what you will be seeing tonight. I'm certain that many of you are aware of the evolving and changing landscape in therapeutic options for our patients with inflammatory bowel disease. The list is growing very rapidly, and at times it's really hard for us to keep up the speed on those choices. Originally, CANIBD developed a biological tool in 2020 that was available in a PDF form on our website to help nurses participate in treatment discussions with their patients and their colleagues. Over the past year, CANIBD has been collaborating with Bridge Medical Communications to revamp all of our tools. Our goal was to develop tools that were electronic, easily available, easy to navigate and use, and something that can be updated in the future. Tonight, I would like to welcome Kristin Serodio from Bridge Medical Communications. Kristin and her team have been the creative minds behind these projects. Kristin is going to walk us through the Crohn's disease advanced therapy tool, explain its functions, along with her tips on how we can optimally utilize it. We will be taking questions via the chat box below, or you can also use the Q&A box. So please welcome Kristin.
Thank you so much, Jennifer. So to give some background, as Jennifer mentioned, the tools were originally created in 2020. So they were initially PDFs, as you can see here. This was the initial layout. So we had both the Crohn's disease and the ulcerative colitis tool. And then as we moved into 2024, the tools have evolved to this digital format, as you see here. So the tools really are just a collection of the advanced therapies currently being used in the treatment of Crohn's disease. So let's dive into how the tool is actually structured. So the tool has 5 main pages. First is the home page. And then we also have the treatment options overview page, which has a variety of information on it, including brand names, companies, reimbursement and logistics programs, classes, and general actions of the different therapeutic options. Next, we also have testing, logistics, and monitoring. So under this page, you'll find details regarding pre-testing and vaccination, location, dosing, and more. Side effects is exactly how it sounds. Side effects for each of the different treatment options are listed here. And then also special populations. There are 4 main special populations that are focused on in this section, including pediatrics, elderly, pregnant, and breastfeeding. So within each of the pages of the tool, the content is actually then shown via a tab format for each of the treatment options, as you can see here. The tool has a highly useful functionality incorporated in it that allows users to create individualized provider resources on the content that they're most interested in. So in order to do this, you can use the Save Page functionality to save content that's associated with either a specific treatment tab or with all of the treatment options that are available on that page. And then once you've selected the content that you would like in your provider resource, you would then click Access the Saved Pages, or you could click Provider Resources. That's always available in the footer, and access the provider resource in that way. Additionally, on the provider's resources page, you can then print or share the individualized resource. And you can also choose to generate a resource with all of the information and all of the pages for a specific treatment option as well. So if you want to know everything from a treatment option overview to side effects, to special populations for a given treatment option, you can go straight to the provider resources tab, click on the white and orange button. It takes you to a secondary page where you then select the therapeutic option that you're most interested in. And then from there, it will generate the provider resource with all pages associated with that treatment. Here we give you a brief idea of what's available in the way of additional hyperlinks to other resources. So from the treatment options overview tab, users can access product monographs along with PSP sites and hyperlinks to those program sites. And if you do have any feedback or questions and you would like to proceed with contacting CANIBD, you can do so in the footer by pressing Contact Us. So let's explore the tool. So the tools are currently located on the CANIBD page of the Crohn's and Colitis Canada website. So when you start from the home page for Crohn's and colitis, you go to Research. You find your way down the list to Canadian IBD Nursing. The menu then opens to Learning for Nurses, and you click that. And then from there, you go down. You can see Advanced Therapies, Teaching Tools. And then you click into the tool of interest. So for today, we're focusing on the Crohn's disease tool. So you click into that. And then the tool opens. And close that one. And then this is the home page for the tool. So I'm going to just orient you to this page before we actually explore the tool too much. So you can see that there is actually a few different navigation options that are available. So in order to use the tool, you can either choose to navigate through using the header at the top of the page here, and you can select which page you're most interested in. Either that, or as an alternative, there's actually buttons along the side that takes you to the exact same content. On this homepage, there's also some additional background information on biologics, and then also on small molecules. And then there's also some hyperlinks to some educational videos that you may find useful as well. So it's aptly named to Get Started. You can also have the option of clicking on the Get Started button. And this is actually a little bit different than taking you to an individualized page. So by clicking the Get Started button, it will actually take you to something we call a one page. And a one page is essentially a compilation of all the pages that are within the tool in one scrollable page. So you can simply scroll up or down the page to see all available pages versus going to one of the pages via the header or the buttons, which will take you to that specific page. So if we click Get Started, you can see here that all of the pages are available. So starting with the treatment options overview page, as I mentioned, the content for each therapeutic option is available in a tab format. So in order to go to the content you're most interested in, you just click the tab along the top. Same goes for all of the pages. They're the exact same format. So from here, if you wanted to go to, let's say, the actual product monograph, you would just click and it opens it in a new tab. And it takes you directly to the product monograph. Similarly, if you were to go to the PSP program, again, it would take you directly there. So that gives you a general idea of the treatment options overview. Next, if I wanted to specifically go to the testing logistics and monitoring page, again, I could either scroll down or I could do so from the header at the top and go directly to that page. And you can see here, only the content associated with this topic or with this page is actually shown here. The same layout is for side effects And for the side effects page, you can see that all side effects are listed in a very clear, very simple bulleted format for all of the therapeutic options. So if I wanted to go ahead and print these off, say I wanted to discuss them with a colleague or perhaps provide them to a patient, I could simply go to the bottom here, and whatever treatment options I'm most interested in, I can choose by clicking Save Current Tab. And say there maybe are two treatment options that I wanted to share. I could go to the second option that I'm most interested in and click Save Current Tab. And then in order to view the provider resource that I've now created, I could go to View Saved Pages here, or again in the footer on every single page, you could also go directly to Provider Resource. So to give you an idea of what that individualized resource looks like, you then go to View Saved Pages, and the details are populated there for you. So you can go back. Now, you may find that some of your saved pages are still checked off, depending on what you've saved and when. So if you would like to completely clear your pages, your provider resource that's generated, all you do is click Clear Saved Pages. And then you can see everything that I clicked on all the treatment options that I was interested in have been completely cleared, and I can start fresh. Now, for special populations, you can see the layout's really very intuitive. Again, everything is in a simple table format. So I also wanted to show you an additional feature of the provider resources that are available. So if you did want to print all of the pages for that specific treatment option, you would click here, and then you can choose the treatment option of interest, let's say infliximab this time. And when you click Submit and View Saved Pages, you can see here that initially the print page option is actually not available. And that's just because everything is currently populating for the pages. But you can see all pages associated with infliximab have now been populated into this provider resource. And then you can go back up to the top. And now you can see that everything has generated. Depending on your internet speeds, time may vary slightly, but now you can choose to either print this page, or you can also share the page. So by sharing the page, it comes up with a specified hyperlink that you can then send via text message if you're using this on mobile, or you could also send it via an email and share it that way as well. Or if you would prefer to print, you can go to Print Page. It will take a second to generate, but then you can see the print pages are also then available for you, and you can print them off at your leisure. So that gives you a general idea on the saved pages and the provider resource. And again, if you find that some of your options may still be clicked, you can just simply clear, and it would clear everything for you. Now, if you want an easy way to get back to the home page, we've made that as simple as possible by linking it with the icon that you see at the top. So if I click on the icon, it takes me directly back to the home page, and you could start anew from here if that's what you find easiest. Now, as mentioned, if you did want to go ahead and provide any feedback, or if you have any questions, need any support at all, you can go to Contact Us at the bottom here, and an email address appears that you can send your questions or your feedback to. Additionally, if you did want to actually go to the resources or the references that are used throughout the tool, we do also have a list of references available within the footer as well. And that gives you the basic demo overview. So we'll just proceed with some very important details, the access details. So in order to access the tool, like I showed you, you can do so via the Crohn's and Colitis Canada website. We do have that linked here. We will actually be distributing the link after the webinar as well. If you wanted to take a peek in the time being and you have your cell phone handy, you could also go ahead and simply scan the QR code on your screen, and it will bring you to the mobile version of the tool. I'll give everyone just a few seconds in case you'd like to do that. I know sometimes it takes a minute to capture. Okay, so hopefully everybody got a chance to visit that. As I mentioned, it is compatible across devices, so both desktop and mobile as well. You can see for mobile, there is a little hamburger menu at the top, which is actually what your main menu is instead of the long green bar that you would see in the desktop version. So it'll just be a drop down with the available pages. So you were probably wondering about some of the other exciting tools that are going to be coming available. So as mentioned, the Crohn's disease tool is currently available. The ulcerative colitis tool will be available in May 2024. And then there's actually going to be a vaccination guide tool that will be available this May as well. And now we can move into questions. Jennifer, I think you were going to provide instructions on how the questions could maybe be structured. I think it was going to be via chat, but I'll let you take it from here.
Thanks very much. That was a great overview. And I think my only comment was I think it will take people a little bit of time just to familiarize themselves with it, to get kind of all of the hidden gems in there that you were pointing out. But this presentation actually will be recorded and will be on the CANIBD YouTube website. So if they need to go back and review some of the tips that were provided, you'll have access to that as well. Just to remind everybody that if you have some questions or you like clarification of a certain part of the tool, please put your questions in the chat box below or in the Q&A box, and we can certainly ask those questions to Kristin. I think, Marie-Louise, did you have any questions that you wanted to run by Kristin tonight?
No, thank you for the straightforward explanation. I know when you were walking Jen and I through it before, we got caught up with a couple areas, so thank you for simplifying it. Just wanted to make a comment that the information available on the tool is from the product monographs and from research. Your own individual practice may vary with some of the pre-biologic workups. We are going to be revising the tool every 3 to 6 months with any new information that becomes available. So if you see anything that's missing or have any questions, please let us know. You may not see the changes right away, but we will be tracking them and incorporating them going forward.
Great. Well, I just had a quick question, and I think you alluded to it, but I just wanted to clarify it for everyone. And that was when you were saving sections of the tool, that will stay saved until you clear the page. Is that correct?
Yes, it often will. There's the odd chance that it may have cleared depending on what you've clicked, but the vast majority of the time it will stay saved. So you would just have to clear your saved pages as I showed. There is the chance that even if you close the tool and reopen it again, it could be saved in your local computer cookies. That clears quite frequently, but if you close it and then a couple of minutes later reopen, you may find that some of your saved, some of the pages or the tables that you saved are still showing as saved. So again, just clear the pages and everything should be cleared. But to be very clear, nothing is being tracked. The tool isn't storing that memory. It's to your local system.
And we have a question about whether or not the tool will be translated into French. That is the long-term goal, but as of yet, we do not have an anticipate release date for that. If you are potentially interested in helping us translate into French, please do let us know. We're always looking for French speakers to help with tool translation, as most of the steering committee members are not fluent in French.
Any other questions that the group may have? While we're waiting just for questions, I did want to just highlight that I know Kristin alluded to it, that we will be launching our ulcerative colitis tool later this month. We are hoping to perhaps host another webinar, although it's very similar to the Crohn's disease tool. We would like to hopefully recapture some of the information there, but also perhaps try to reach out to some of our members in the West Coast that weren't able to join in today. We also have coming up, Melanie Watson has been spearheading our vaccination tool revision, and I know this was a very popular tool that was one of our first ones that was developed by CANIBD, and since then there's been an enormous change in vaccination requirements, and so she has done an incredible job on updating that, so we're really excited to present that to you in the next month or so.
So in the tool right now, it's actually listed the mode of administration, whether it's IV, sub-Q, or pill format. If it's a IV loading doses, how many they get, and when they switch over to the subcutaneous injections. It also lists the location of where they get the infusions or administrations, whether they're doing it at home or if they're going to a clinic. So that is built into the tool right now.
Is it possible, Kristin, to pull that up?
I'm doing that as we speak. Yes, just give me one quick minute here.
As you can see, there's a method of administration, location of where they receive it, and then when you go down to dosing, we'll walk through what the loading doses regimens look like and approximate time required to do whether it's infusion or injection.
Perhaps we could skip over to the last item, the upadacitinib, and that will show that it is an oral therapy.
And as you can see under dosing, it gives the range for maintenance of 15 or 30 milligrams. And the other medications also of that, especially in regards to infliximab, whether it's 5 or 10 milligrams.
Hopefully, Evelyn, that answers your question. Looks like we have another question about, will we be available to present this tool in one of our meetings in Montreal? Absolutely. If you want to reach out to one of us through the website at the bottom of the tool, the CANIBD, we will reach out to you directly and we can talk about that for sure. Marie-Louise, anything else you'd like to add tonight?
No, just a thank you to Bridge Medical and Kristin. We're not the easiest to work with because sometimes you chase us down to get the information you've asked of us. So thank you for your patience, and thank you to Jen for really spearheading this tool. We hope that you use it. Please recommend it to your friends. We are tracking the clicks to prove the usefulness of it.
And we're really excited to hear your feedback as well. I know there will be some good and probably some not so good, but honestly, we appreciate everything you have to say, and we'll try to make those changes as quickly or as much as possible. And we're just very excited to be able to showcase this tonight. And I know Marie-Louise said show it to your friends, but also other healthcare provider colleagues. It's not just a nursing tool. I think everybody could benefit from this.
Especially with ulcerative colitis, now that we have 10 molecules and advanced therapies.
Mm-hmm. It's quite impressive, that tool. So anything else you'd like to say, Kristin?
No, just thank you so much for including us. It's been a real pleasure, and we're glad to see that the tool is popular just with the attendance tonight, and we're excited to see it starting to be used.
Mm-hmm. Okay. Well, thank you very much, everyone, for joining in tonight. Please keep an eye out for your newsletter that will come out. We'll have up-to-date webinars scheduled for the UC tool as well as the vaccination tool. We also have a webinar coming up in mid-May on May 14th on 5ASA updates. So please check your newsletter and register for that webinar as well. But thank you very much, everyone. Thank you, Marie-Louise.
Thank you, everyone.
Take care and have a great night.
Thank you. Bye-bye.
Bye.